Hi, this is Dr. Christopher Van Tilburg with the Hood River County Health Department. I'd like to give you a brief update. It's Friday evening. You may have heard that the county's request of Governor Kate Brown to allow us to move from phase 1 opening to phase 2 reopening has been put on hold. We're on hold for at least a week, so we are currently in phase 1 and we're not moving into phase 2 yet. We've had 71 cases of coronavirus thus far in this pandemic. 68 of those are test positive, and those are our latest totals. It will go up by Monday morning. You'll see more cases that have come in today and over the weekend likely. Our test positivity rate is 3.6%. So 3.6% of all people tested turned out to be positive. And that's markedly increased from where it was a few weeks ago when we were around 1.5 to 1.8%. So we definitely have some more cases of coronavirus in our community. I can't give you the exact reason why we're having increased cases of coronavirus. It's likely due to a number of factors. One is we're doing more testing. Two is we're testing folks who are asymptomatic and have no known contact that requires testing. Three is we're doing a massive amount of contact tracing, both in Hood River County and statewide. And number four, probably the most important reason the case positivity rate, the test positivity rate is going up, is because we still have coronavirus in the community transmitted from person to person. Now, I've looked at most of the data in Hood River County and looked at the recent cases that we've had over these past 2 weeks, most of which can be attributed to an outbreak, a single outbreak. And I believe that we don't have the tourist traffic yet to account for the increased test positivity rate, at least not to account for most of it. And I don't believe we have the migrant farm workers yet the influx hasn't arrived here yet. And so I don't think that is affecting the increase in cases as much as probably what's causing most of the increased cases in Hood River County is it's still being transmitted from person to person among those of us that live here. So, can it be transmitted by an asymptomatic person? Well, the answer is yes, and there's three different ways it can be transmitted asymptomatically. One is, for example, if I did not have coronavirus, but I touched a doorknob from a doorknob that somebody who had coronavirus just touched, and then I high-five my friend, and then that friend touches his or her nose, that's a way of transmitting coronavirus through my hands, and that's why hand washing is so effective. There's another way of asymptomatic transmit is if somebody gets infected with coronavirus, but they don't get the disease. So they carry the virus and they replicate the virus, but they don't get the disease. We don't know how many people are walking around the United States right now transmitting coronavirus without any symptom. The third way you can have asymptomatic transmission is somebody who gets the virus and gets the coronavirus disease, but they transmit it before they have any symptoms. So in 1, 2, or 3 days after they've become infected, but before they have symptoms, that's sort of a pre-symptomatic stage, they can be transmitting coronavirus. So regardless of how many people have it who are asymptomatic or how many people get it on their hands that then propagate it, the most important thing is we still have coronavirus in our community and it's transmitted from person to person. Okay, what is the health department working on? We've been doing a fairly massive amount of contact tracing. We have experts at the health department. Our staff is really doing a fabulous job, working 7 days a week, and we are tracing some 100 people. We have bolstered our in-house contact tracing with some help from the state and with some help from some community partners. We are able to currently keep up with all current coronavirus contact tracing now, but having a little extra help kind of bolsters our personnel and gives us a little more flexibility to work on other things. We've established a call center in Hood River County. It's not operational yet, but it's ready to go, and it's just in case we need it. So we have an off-site facility with some computers and phones ready to go if we need it. We have been supporting a number of different businesses, and from what I can tell, the businesses in Hood River County are doing a great job at protecting their employees and protecting their clients and their customers. And really, they are trying very hard to create safe workplaces. The health department, as I mentioned before, is helping some families that have low resources or no resources to give them assistance with housing and food. This is just in a few circumstances that we're able to do this, fortunately. We are organizing fairly massive testing, as we've been doing the last 2 weeks, and that's largely with the support of our community partners who are actually doing the testing. And that's some local clinics and hospitals that have really stepped up to help the health department and help our community. And then finally, the health department is really assisting businesses and workers on return to work guidance. So we're applying the Oregon investigative guidelines fairly methodically and diligently to those people who have either tested positive or presumed to be positive, or there are persons under monitoring, and giving them appropriate clearance for return to work. So it's been a busy week. It's been a busy month. We have had a lot of people that have asked us if they can help in some way, and if a lot of people have offered some volunteering time. And I want to express today thank you to all those folks, and I also want to let you know, if you're watching this, what you can do to help the health department and what you can do to help our community. And those are fairly straightforward tasks, but they are kind of difficult to do sometimes. And that is, keep physical distancing, wash your hands often, wear a mask, and please stay home if you're ill and call your primary care provider. And those 4 things are really going to help us keep the community safe and limit the transmission of coronavirus. If you want to gather in groups, gather in small groups. If you want to gather in small groups, try to keep outside. I mean, we're Oregonians, we're used to this January weather. We go outside a lot of the times when it's raining, and keep it outside. It's much safer than inside. So that's all for now. Be positive, be safe. Thank you very much.